A 29-year-old patient presents with an inability to flex the distal interphalangeal joint of the index finger and is determined to have a nerve damage from a supracondylar fracture. Which of the following condition is also a symptom of this nerve damage?
Flexor digitorum profundus. Flexor digitorum profundus flexes the distal interphalangeal joints of the medial 4 digits. Okay, medial 4 digits. It helps to flex the wrist joint also. Whereas flexor digitorum superficialis. Flexor digitorum superficialis flexes the proximal interphalangeal joints of the medial 4 digits. Acting more strongly, it also helps in flexion of metacarpophalangeal and wrist joints. Here, it helps in flexing the wrist joint. Around the muscle flexor digitorum profundus. It is supplied by the medial half, it is supplied by ulnar nerve, and the lateral half it is supplied by anterior interosseous nerve, a branch of the median nerve. Okay.
So we have found it as median nerve. Now let us go to median nerve.
See here. In case of injury of the median nerve at the elbow, in supracandicular fracture of humerus, application of tight tourniquet during venipuncture, or intraoperative nerve between two heads of pronator teres or under the fibrous arch connecting the two heads of flexor digitorum superficialis, we should know what happens. Forearm it is kept in supine position due to paralysis of pronator teres, loss of pronation. You cannot pronate. So always the forearm will be kept in supine position if there is an injury of median nerve at the elbow because of supracandicular fracture of the humerus. Always in supine position, loss of pronation. Okay. Wrist flexion is weak. Wrist flexion you cannot wrist flexion it is weak, it cannot be flexed. Adduction of wrist. Okay, adduction of wrist due to paralysis of flexor carpi radialis. So flexor carpi radialis and unopposed action of flexor carpi ulnaris. Ulnaris it is used for adduction and flexor carpi radialis it is used for abduction. So since there is a paralysis of flexor carpi radialis and flexor carpi radialis it is supplied by median nerve. Adduction of wrist happens. Wrist flexion is weak. No flexion is possible at the interphalangeal joints of index and middle fingers. Yes, of course. Inability to flex the interphalangeal joints of index and middle fingers. Not the ring finger. In the question they have given us.
In the question, the first option is inability to flex the distal interphalangeal joint of the ring finger, but that is wrong. Inability to flex the interphalangeal joints of index and middle finger.
Benediction deformity of the hand, that is patient when tries to make fist, index and middle fingers remain straight due to paralysis of both superficial and deep flexors of these fingers, leading to loss of flexion at the proximal and distal interphalangeal joints. Loss of flexion of the terminal phalanx of the thumb due to paralysis of flexor pollicis longus.
Thumb deformity in which senar eminence is flattened, thumb is laterally rotated and adducted due to paralysis of muscles of thenar eminence, not the thenar eminence and normal adductor pollicis respectively. See here, this is the thumb deformity, thumb is lateral rotated and adducted. In question they have given us atrophy of hypothenar eminence. That is not the actual case. Atrophy of thenar eminence happens. Okay. Loss of sensation in lateral half of the palm, lateral 3.5 digits, and also on the dorsal aspect of the same digits. Yes, of course, loss of sensation over the distal part of second digit happens. Paralysis of all the thumb muscles. No, thumb muscle it is not involved here. All the thumb muscles are paralyzed. No, adductor pollicis remains normal because adductor pollicis is supplied by ulnar nerve. That's why. See here, adductor pollicis remains normal adductor pollicis respectively. They have given under the heading thumb deformity. So option C is right.